itself, there we go. Thanks, Matt. We'll only be sharing this with the consortium itself. It won't be made publicly available. Okay, so, oh, sorry, I'm on the wrong bit. So, yeah, 5 things in the agenda. It's really heavily weighted on this first one, the sort of update of how we're getting on with the roadmap paper. And sorry, I'm just going to mute Ross. There we go. What I'll do is I'll stop after each one. I normally go through them and then ask you to comment so that people who are watching this later on can sort of get a quick sort of 15-minute summary. But I think I need to get your updates or feedback on the roadmap paper while still fresh. So that's the plan for today. So I'm going to jump straight into the roadmap paper. I don't know how many people here won't have heard about how this is going. And so what I'm going to give you today is a summary of sort of how the story is going to be told, if you like, and just quickly go through the introduction and then go through the figures and how they're going. So I hope this makes sense. Obviously, I'm sort of buried deep in all this, so I appreciate I'm going to miss a lot of it out. But yeah, so this is the sort of how we're explaining the introduction. So, you know, just sort of pointing out that there's huge human and animal health and economic benefits of pharmaceuticals. Usage has been rising for many years, largely without consideration of the environmental impacts. Obviously, some people might disagree with this statement, so tell me if you do. Sustainability efforts are now currently focused on reducing the carbon footprint, but now, obviously, with the triple planetary crisis, you know, there's increasing demand and need for solutions to look at pollution and biodiversity as well as climate. So, and then I'll introduce the issue of pharmaceutical pollution and the challenges of addressing this, and the challenges, you know, the kind of, I guess, the strategic challenges in terms of what needs to be managed, things like the uncertainty over the data, the conflicts of interests or the conflict in needs amongst the different stakeholders, the social injustice, accountability, the fact that no one in particular is accountable for all of this, and the depth and breadth of the issue. And all this kind of then says, okay, well, we need a systems approach, we need collective strategizing. So we need all the stakeholders to have a voice in this. This needs to be context specific because it needs to, you know, consider the context, so the regulatory, the operational context within which this is looked at. And so that justifies why we've got a UK focus, because it needs to be context specific, and why we've got a human focus, because again, the upstream drivers of human antibiotic, this is me, having worked on AMR for too long, human pharmaceutical usage, the upstream drivers are, you know, overlap, but are different to the animal ones. And I found these figures as well, which sort of suggest that the human pharmaceutical market is about 30 times bigger than the animal pharmaceutical market. So that's kind of another reason, I think, to focus on humans at this point, because, you know, the bulk of the pharmaceuticals going into the environment are human. Now, again, tell me if I'm getting any of this wrong. So, oh, Ed's raised his hand. Do you want to?
Yeah.
Go on, then,
just a quick. I'm just going to say that's not necessarily so, because it depends on what happens to the pharmaceuticals and how much goes into the environment. So if there's much more leakage from animals into the environment, whether it's an order of magnitude as there is there, so it's an empirical question.
Yes, on how. Yeah, thank you. Yeah, I mean, I obviously will put this into context and include all these. Go on, Karen.
Very brief comment. I think it's really nice to see these figures. Actually, I hadn't seen them. I think you'd need to be a little bit cautious with equating the value, the economic value, with the pharmaceutical load in the environment, because it might just be that animal drugs are not subject to the same level of scrutiny, or I don't know. They might just be cheaper because they're produced in bulk and whatever.
Yes, yeah. So I definitely will include all these. But yeah, this is all really good because, you know, I found these figures and I was like, oh, this is interesting. But yeah, I'll make sure I'll put all these sort of, well, I don't know what the word is, provisos or, you know, statements.
Caveats. Yeah.
Caveats, that's it. Yes, thank you. Okay, so yeah, this is the introduction. Again, it's just sort of setting the scene for what we're then going to come on to, and you will all get a chance to feed into all this once it's, you know, once I've actually got something to send to you properly. So I sent these on email at the last meeting because I cancelled the meeting because it was unfortunately right near Easter. But so going into the paper, then we start with sort of saying, right, pharmaceutical usage in UK healthcare, we need to find a balance. I don't know what you think about this idea that the risks are now outweighing the benefits. So having it on a slant, is that too bold to say that the risks are greater than the benefits? And sort of saying about how social injustice applies to the benefits and the risks, and you know how the benefits are huge, but we really need to balance these, and in particular the short-term benefits. You know, the benefits are more short-term and the risks are potentially more long-term. I think, did Caroline flashed up and then Ed flashed up. Caroline, did you have something you wanted to add? No, I can't actually see any faces. So, Ed, do you want to go in?
Okay. Yeah, I like that analogy. Also, you can then extend it by saying, "Oh, we're looking to balance the scales or whatever." But yes, I agree entirely. It's a question of it's a cost. It's an externality that isn't being taken into account in the price of drugs, and therefore we need to internalize that externality, to put it in economic speak.
Thanks, Ed. As you know, it's not a language I speak super well, but yeah, perfect. Thank you. Okay, so that's you know, just setting the scene. We need to find a balance. This isn't about just saying we need to, you know, it's all about the environment. It's saying it's a balance between the human, economic, and environment.
Can I just make a comment there, please, if I may,
Yeah.
Kelly? I mean, at this stage, I would suggest that the risk-benefit balancing should really be probably equal. You know, I mean, we don't know, I don't think, as much as we don't really know the risk-benefit balance. That's what we're trying to find out. And to start off with the supposition that it's, you know, the risks are greater than the benefits. Am I reading that right? If it's going more to the left, then, you know, you're already saying that the risks are greater than the benefits. So I think, if in fairness, it should start out as an equilibrium rather than, because we at this stage we're trying to find out, I think, what the relative risks and benefits are in right the way through the system. So in terms of equity, I would think one would start out at equilibrium probably.
Okay, thanks, Mike. Does anybody, do you know what? Fiona's put her hand up. I'll go to Fiona, and then I'd like to come back to this at the end because I think this is a really important thing that we need to agree on. Fiona.
I just wonder if the benefits are fully described, because isn't, you know, improving health outcomes, I'm not sure that's fully described. Surely that's a benefit. I mean, that's the main reason why we use drugs in the first place. Is that fully represented? Because I don't think, for me, quality of life and life expectancy quite captures that, really. So all I'm saying is that one of the things you immediately notice when you look at it is there are many more blocks for risks than benefits, which makes me question, are all the benefits fully realized? I mean, they may or may not be, but I think we just need to be careful, because if all the blocks are equally weighted, which clearly they're not going to be, by definition they're going to tip to the left because there are more of them. You know, anyway.
Yeah, no, I mean, yeah, and this analogy of the balance, it opens up loads of questions, and that's why I would really like to talk about this properly with you all, because like you say, some of these, like economic growth, you know, quality of life, or, you know, health outcomes, they're huge benefits. So yeah, I mean, I think one of the feedback was, should this be a balance? Should we just be you know, stating all these things rather than sort of suggesting that there is a balance? I guess it's the idea that we are trying to balance environment, human and economic. But yeah, okay.
I think the other thing just to say is that it's a dynamic equilibrium, isn't it? So it's going to change over time. I mean, what we've learned with health inequalities is that you don't solve it. It's basically a balance of all the factors in the system, and that's going to be true for this as well, and that's going to change. So maybe something more, you know, I don't know quite how you represent that. It's kind of almost like a yin and yang symbol, but it's kind of an interrelationship, but because we can't think the problem solved, because it's going to constantly be challenged, and that's why we need to be vigilant.
Yeah, and that goes back, I guess, to Mike's comment about showing that this, it's an equilibrium, maybe. Yeah. Anyway, right. Thank you very much. That's really helpful. I'm going to continue because there's other figures, and then but yeah, bear this figure in mind. Cool. Thank you, everyone. So then the next figure. So we talk about the needing to find a balance. Why won't this go forward? There we go. Right. And then just sort of giving some background into how do healthcare pharmaceuticals from the UK get into the environment. Now, this is my kind of, 5-year-old drawing skills. We're working with the graphic designers at the moment to make it more like this one on the left, which is the sort of style of our animation. But I won't go through I won't explain it until we've got a proper one. But essentially, it's just sort of showing that, we have water treatment. It goes to different, households, research and development, manufacturing, healthcare facilities. It goes to wastewater treatment plants, and there's various routes by which it gets into the environment. And the routes that the graphic designer is talking about having 4 different main routes to the environment. So one is treated wastewater, another is untreated wastewater. So things like obviously combined sewer overflows, septic tanks, gaseous, so inhalers, asthma inhalers, anesthesia gases, incineration. But obviously this isn't, as my understanding is, once things are incinerated, they're no longer pharmaceuticals, but they are still, pollutants that contribute to climate change. But yeah, so the main thing is inhalers and anesthesia, and then solids from landfill or biosolids from wastewater treatment plants. So these are the 4 routes, and then we'll talk about potential biodiversity impacts, like the routes for impact. So direct exposure, indirect exposures through the food chain. Again, and I say potential, we'll make it very clear in the text that, the level of evidence we have for this, drinking water, bathing, agriculture, and then we'll talk about AMR risk, and the impacts of climate change on all of this. So this is just sort of introducing people to the background. Yes, Ross.
Yeah, I was just going to say, with the TSOs, you need some kind of bypass pipe that goes around the wastewater treatment plant. So the whole point is that it's not treated.
Yeah. Okay. Yeah. I mean, this is it. Every time we talk about it, then there's ways to make it, more
Complicated.
yeah. So yes. Okay. Yeah. Well, bear that in mind, I guess. Yeah. Anyway, I'm not going to start talking about the detail, but there. Thanks, Ross. Let me just write that down. So yes, pass. Okie doke. So yeah. So that's the background, and then we sort of come into our systems approach. So we talk about the UK operational and regulatory structures that underpin pharmaceutical pollution from UK healthcare. Now, this is the sort of flow chart. So in the working group report, you were all sort of commenting on the process. We've then taken that and we've made this sort of flow chart process. These things say, I can't read it, like prescribing, procurement, clinical guidelines. These are all processes within the whole system, and we've grouped them into supply, use, and waste. And this finishes with environmental pollution, and then that has the impacts of that. And then we have the drivers, so the commercial, economic, political, ecological, social, and cultural, this whole range of drivers that influence all of the processes across this. Now, this is sort of essentially sort of showing the system again in some ways, but really the idea is mapping out the structures. And for each of these nodes, what we've been doing is we've been creating a table, and this is either from our own literature searches or from information you've given us. And so each of these nodes, so, you know, here, develop a health condition, it's just a background of how this works in a UK context. So in a UK context, sorry. So the operation of regulatory structures for the UK context, and the same with landfill, septic tank, waste treatment. And so these two sort of go together to really give a description of the UK context. And on the left here, this is the first draft from the graphic designer of you know, how this might look a little bit nicer. It's not finished yet. We need to move all these around and get the right colors and everything else. But yeah, just to say, these are going to hopefully start looking a lot snazzier than my sort of starting efforts. So that's the kind of to give the UK context. And then we go into our systems sort of depth. So then we talk about how we're looking trying to understand the depth and breadth of the issue. So not just looking at the sort of low-hanging fruit, the structures that people usually talk about, but also looking at the underlying goals and mindset. So we introduce the iceberg model, and then we say about how each of the working groups has been coming up with these summary statements, which hopefully you'll remember doing. And again, you'll have time to feed back into all of this. So yeah, this is the situational analysis of the depth being obviously the sort of depth of the iceberg, and the breadth being the 5 different working groups. So that's the situational analysis. And then we come to our roadmap for action. So I don't know how we're going to present this yet. We're still talking to the graphic designers, but the idea is we've obviously applied this iceberg across all 5 working groups, and we're looking at leverage points at each of the different levels. And then we bring this all back together to look at the whole system. And the idea is that evolve, which is the sort of deep-rooted mindsets, this is in the center, this is the, you know, the heart of the system. These are the change in mindsets. And what also we've seen as we've been developing this, actually the mindset leverage points are quite similar across all the 5 working groups. You know, these are kind of more fundamental culture and sustainable development goals type things. And then as we get further out, they get more specific to the sector and to the different sort of area, like industries, I guess. And so, yeah, like I say, we don't know yet how we're going to present this, but the idea is that this sort of flower, if you like, that's become this sort of concentric rings of optimize, transform, evolve. I don't know if we need this or whether we keep the flower, not quite sure yet. Like I say, we're working it all out, and if anybody's got any ideas, they're very welcome. And then from this, we actually list our leverage points. So we need to optimize the operational structures, and these are the leverage points. Transform sectoral goals, and again, we've got these leverage points, and then evolve the societal mindset. So that's our roadmap. That's kind of where it all culminates. And then obviously we'll have conclusions for that on, you know, the need to, you know, the idea of evolution, not revolution. So this is a coordinated system-wide change that's needed rather than individual sort of technological solutions necessarily. So that, and then just to say, I was going to send this to you as individual bits throughout the way, but I think it's probably easier to send to you when it's all complete. I might send you the tables because it's really long, just as first of all, but we'll see how we get on. But I think at the moment, I'm probably going to send you everything in one go so you can see the whole thing together, probably by the end of July, by the time we've brought it all together. And the target journal is still the Lancet Planetary Health for Perspectives article. And yes, and Karen, perfect timing. Any questions or feedback before I go on to the next item?
Yeah, so I get my hand in quick there. So questions on the. Oops, sorry, I knocked something over. Question in terms of our kind of vision for change. Have we got any particular criteria, and the one I'm thinking of is mainly the social justice side of the outcome. So if you start, I don't know, requiring stricter environmental protocols at manufacturing, then that will affect manufacturing plant in different countries in different ways because of the regulatory context and the resources available to them. And equally, there's issues around access to medicines, of course, that needs to be safeguarded. So do we have a sort of framework for evaluating or setting criteria for any solutions?
No, so I'm just gonna come out so I can see everybody. So I think this is very much a top level at the moment. Like all the I was going to come back to this at the end. Those very detailed working group reports that we have, which are just a huge source of really valuable information, which everybody's fed into. I see that as the next step for this. So, going into these areas in more detail, and I think a framework like you're talking about, and I mean, I don't know what everybody else thinks here, but that sort of level of framework, I feel needs a lot more discussion for each of the different working groups before we can take that further. But I don't know if anybody else disagrees there and thinks we should be talking about this more here.
Maybe it's just something to highlight for future research, though, so it doesn't get forgotten about.
Yeah.
Because I think it is quite an important part.
I totally agree. And I know, we're going to try and make sure the social injustice is made very clear throughout this. Like I said at the start with the balance figure, it's the benefits that aren't equal as well as the risks. So yeah, I think it's important to include. Cool. Thanks, Karen. Does anybody else have any other thoughts or comments?
Just a quick one, Kelly, if I may. It's Mike again. When are you looking to finally publish? I mean, you're saying you go the draft out in July. When are you looking to send for publication, basically? I think that's interesting because I think it would be helpful to, even though I understand your idea for sending a final draft, but I think it would be helpful to see just see the slides at least, properly today and maybe expand a little bit in expanded view so that we can see the individual elements of them, which obviously we couldn't see looking at it on a laptop. What's the final publication date envisaged as?
So at the moment, we're working to finalize the figures and, bring this all together. And then because we've got these policy workshops in London in a few weeks' time, we're hoping to take these draft figures to this workshop and sort of show it to people and get feedback. But then I guess the detail of the how the writing of the manuscript, that is sort of coming together. I guess it's all kind of coming together at the same time rather than having individual originally I thought, I'll send the figure 1 and the information for that, and then I'll send figure 2, which I can do. I can send you the figures and the figure legends, but I can't send you the manuscript where it's all going to be explained.
No, appreciate that, but just the sort of seeing the figures expanded would be quite helpful, just to see that some of the detail of it, I think, at this stage, before you get too far along the drafting line, as it were.
Yeah. Okay. Well, I mean, I think so what I've got at the moment is kind of what I sent out at the end of when I cancelled the last meeting, and I sent an email summary. So I sent the figures with this brief figure legend. I don't have anything more than that at the moment because the graphic designers are working with them. So okay. I'll dig that out and send it out again so that people can, if anybody missed it. But yeah, unfortunately, it's because it's all kind of trying to come together at the same time, and we're trying to make it all look cohesive, I guess. But yeah, I will send you what I've got, definitely.
Okay,
cool.
Thanks so much.
Does anybody else have any other questions or comments? I mean, are you happy with how this is progressing? I don't know if it is very top level. It's not it isn't going into the detail that we have. Obviously we have all these very detailed reports, but I see that as the next, to follow on from this. Ross.
Hi, Kelly. Yeah, I guess there's going to be quite a bit of discussion around that first slide, the balance between benefits and risks. And are we presenting this as a UK view, or is this a global view at this stage in the manuscript? Because it really would matter, wouldn't it, where we're talking about? Probably those benefits and disbenefits are different ratios in different parts of the world.
Yes, that's a good point. I mean, I think that figure is the first sort of part of presenting this as a UK context. So it's sort of saying in UK healthcare, there's a risk, there's risks and benefits, but you're right. And I mean, I don't know. I guess this is the whole point that Mike was talking about, in which countries are the risks and benefits greater and worse? But anyway, yeah.
I just thought it might help with the discussion, that was all, if it was focused on the kind of geographical scale we're talking about.
Yeah, I mean, I guess the paper is sort of saying this is a global issue, but then we are looking at the UK context. But yes, thanks, Ross. We'll come back to that balance figure definitely at the end. Cool. Cheers. Hayden.
Yes, thanks, Kelly. So if we're going to come back to that scale balance thing, maybe I'll wait till then. I was going to just weigh in on that as well at the moment.
Go on, say it, Hayden, say it now.
Yeah, I think that we can, I agree with Fiona that we can draw enormously from the work that we've done in inequalities over the last 10 years to think about those things. I mean, like, we know there's an imbalance there, but the solution isn't to just kill everybody and that way we've got perfect equality. It's about the trade-offs that we need to think about in order to make sure that we are trying to maximise population health whilst reducing inequalities or whilst considering inequalities at that same time. And I think that's what we've got to get the balance right here, is it's about maximising population health, maximising the use of the appropriate use of medicines, but whilst being considerate about how the impact we're having in other areas. So I don't think it's that useful to have a scale that tilts in either direction. I think it's useful to say, these are the risks and these are the benefits of this. We need decision makers to be able to be well informed about those risks and how to quantify those risks in a meaningful way and how to quantify those benefits in a meaningful way, so that we can start to make those trade-offs in a explicit way. Because at the moment we just sort of we're plucking whatever we can at the moment that's out there. It's not really well evidenced and good. We haven't got, I suppose, good structures to make those decisions at the moment. So to me, that's the first step, is to just try and put some framework around it. But it's not about, at the moment, it's off kilter. I mean, we can probably all accept that. We think it's definitely off kilter and it's probably tilting in one direction, but we don't know for sure what the way that is. And it's probably, everyone's going to have their own opinion on their appetite for risk there as well. So I think it's just more useful to have, we can say that there's a scale, but we don't need to, my personal view is we don't need to be really trying to get the angle of that scale accurate. I think it's about these two things that we need to weigh up.
Yeah, thanks, Hayden. So do you think we keep the balance? I'm going to just throw this in now quickly. Do we think we need to keep this balance, or do we think it's better to be stating these things, like just presenting them rather than presenting them as scales, if you like?
So my view is that so the way I present this, when I present this in a health economics contest, is when we have a scale where we're weighing up costs and benefits. As I just have a scale that sort of hangs, and you've got costs on one side, benefits on the other side, with the goal being that we want to weigh those two things up, not that the costs are outweighing the benefit. So in my view, even if you wouldn't even need to have the scale there looking at an equilibrium, you can just say that a scale exists and you've got two sides to a scale that need to be weighed up. I'll sort of be a little bit more agnostic on it, I suppose.
Yeah, okay.
If I was able to present it that way. So yeah, and I think that graphically you can do that much easier with a hanging scale than you can with the balance scale that you've got there at the moment. But
yeah, okay, yeah, brilliant. Thank you, Hayden. And I'll go to Stuart, and then I'll come back. I will then come back to this at the end. Stuart.
Do you want to come back to it at the end then? I was going to say, can I share a screen, because I was talking about this at a conference last week.
Okay.
And I've got a balance picture to share.
Okay, right. I'm going to whiz through the other things then, and then I'm going to come back to this at the end. And yeah, brilliant. Okay, fantastic. Thank you. So let me just share again. This is another thing that might cause a lot of questions though, but hopefully it will be quick. Where am I up to? Let me just whiz through. Okay, so this is the idea. So somebody suggested, when we were talking about journals, someone suggested Lancet, the actual full-on Lancet. And we did email, because we knew somebody who knew the one of the editors, and they said it did sound a bit too neat. Was it niche? I can't remember what it wasn't quite fitting in with the Lancet. And because it's UK focused, and again, we can talk about this at the end, this whole kind of UK versus global focus. But it was suggested that as we present the big publication in the Lancet Planetary Health, we could at the same time write a letter to go to one of the other big journals like the British Medical Journal or the Lancet itself. And so this is an idea we have. If we were going to do this, obviously we could just write a letter on its own right, but we could also do something that's a little bit more, I don't know, bold. I don't know what the right word is. So it could have a catchy title like, does the NHS have a drug problem? And there could be some killer facts in there. So for example, in 2022, NHS England spent so many £1 million, which was so many million prescriptions, on drugs that are known to pose an ecological risk. And, obviously the overall message is that pharmaceutical pollution should be integrated into UK healthcare sustainability plans. And then we sort of point the direction of our new roadmap, which helps, helps with this. Now, I don't know what you think about this in general, but just to explain where we're coming from with these killer facts, and this is just an idea at the moment. So, I'd really appreciate your feedback. What we would do is we were thinking just NHS England, and that's mainly because we just don't have the resources at the moment to dig out all this data for all 4 nations in the time we've got left with our current funding. So just NHS England, if we took primary care and secondary care prescribing data and we looked at, so into 2022, how many prescriptions were for drugs that are either listed on the Water Framework Directive list or the Hazardous Framework Directive list. And so the Water Framework Directive list, so there's a priority list and a watch list. The priority list currently has no pharmaceuticals on it, but there's a proposal to add 10, which it looks pretty sure that this is, as far as I understand, this is going to come in. There's also a watch list, which has got 16 pharmaceuticals on it. So these are compounds that are known to have some sort of ecological risk. And, that's why they're going to be added or already on the watch list. There's also, this is what Wendy shared the other day, the NHS has a list of the cytostatic and cytotoxic drugs. So these are on the Hazardous Framework Directive list, is my understanding. And some of these are the same, like the estrogens are on both. But this is a list of drugs that the NHS goes to reasonably substantial lengths to make sure that these get disposed of into, I think, sharp spins, but somebody can, anyway, they make sure that they don't get chucked away down the drain. And of course, that's being responsible for those that are being used. But some of these drugs are obviously going to get excreted, and that's not being mitigated for at the moment. So the idea would be we would look through these lists and look at the amount of drugs that have been prescribed from these lists in primary care and secondary care. Now, Matt, our research assistant, has already had a look, and just on these Water Framework Directive lists, and this is just in primary care, from 2022, he pulled out that the NHS gave 60 million prescriptions and spent 400 million pounds on just these drugs and just primary care. So obviously, if we want to take this further, we probably need to look at the Hazardous Framework Directive list as well, and we need primary and secondary care. Now, I don't know whether you all think, is this the right way of doing this? Do we need to just take a step back and do this properly and think about this a bit longer? But yeah, any thoughts about this whole idea of this letter and particularly about this data analysis? Hayden.
Yeah, I think overall, I really like that approach. It might be useful if we could show some sort of change in direction though. So whether or not that's that 2.1% and 1.7% of that budget is an increase over the last 5 years, or if it's not. The other thing, a piece of work that I've been doing over the last couple of years is looking at the spend on GDP, or the GDP of the UK, and then looking at the Department of Health and Social Care budget as a proportion of GDP, and then looking at the way that Department of Health and Social Care budget is divided as a proportion as well, which I think is interesting because you can map growth of GDP quite easily, and you can map DHSC budget quite easily, and they normally hold hands quite tightly. They're normally really closely related. However, the DHSC budget, if you look at the proportion spent on pharmaceuticals, is growing at a much higher rate than both of the other two things are when you set the baseline to zero. So relative to each other, as pharmaceutical spend is growing, which means that within pharmacy, within the healthcare setting, is we're having to make trade-offs somewhere. We're either having to do less procedures, hire less nurses, or do something else in order to spend pharmaceuticals, to spend more on pharmaceuticals proportionally to the rest of the health system. That might be okay if we're getting better bang for our buck from pharmaceuticals. So if pharmaceuticals are actually better than the things that we're giving up, I suppose, the opportunity cost of those things. But I haven't seen any explicit policy or any explicit sort of documentation that's saying that this is why we're spending more on pharmaceuticals. I feel like it's just a byproduct of a whole bunch of other implicit decisions that are being made in policy, and we've ended up spending more on pharmaceuticals, and no one's really monitored it or kept an eye on it closely to see what. The big caveat to all of that is that all of the data I've got doesn't include rebates. So my working assumption is that the rebates on pharmaceuticals has stayed linear across that time. So if we're getting twice as much rebates on pharmaceuticals now than we were 5 years ago, then the spend might actually not be as big a change as what we thought it was. But that's another way of sort of thinking about, of demonstrating how, I suppose the other side of doing it that way would be, the other assumption would be that pharmaceuticals are having more impact on the environment than the other things we could spend the money on in the health system. So if you gave up spending all that money on pharmaceuticals and then spent it all on anaesthetist drugs, anaesthetist gases, then we'd obviously do more harm to the environment. But we could sort of say, on the whole, pharmaceuticals, a £1 spent on pharmaceuticals equals X carbon emissions, and £1 spent somewhere else in the NHS equals Y carbon emissions, and sort of make some sort of trade-off there as well. But yeah, so I'm sort of rambling a little bit here, but that's just off the top of my head, just some other thoughts of ways you can skin that cat. I think it's but I do like the idea. I think the approach is good. It catches you. You need to draw people in with something that is quantifiable and that we can capture the imagination with.
Yeah, thanks, Hayden. Yeah, so if we do go down this route, I will definitely be getting in touch to ask you to add all this additional information, these good points. Thank you. Fiona.
I think it's certainly attention grabbing. I guess it's about how much we can control the narrative and what the real message is. Because you can imagine it getting discredited if we're saying that drugs are bad overall. You know, that's not what we're saying, because a lot of this is about the unintended consequences, of how we use healthcare. So I think we just need to be careful around how we frame the message, what we're really saying. I think if you want to get attention, it certainly would. So two things strike me. One is, certainly in the case of ibuprofen, it's an over-the-counter drug. Yeah. So it's not just NHS prescriptions, it's kind of what we all buy. We pop down to the pharmacy for pain control. So I think that's one issue that we just need to be careful of. And then the second thing is, you know, there are some things which might be driving increases, like diabetes, for example, if you're looking at metformin. So there is also something about a bigger set of system problems that are potentially driving the change. And again, this could be about unintended consequences or issues around rising problems with mental health, etc., etc. I think for me, the overarching question is that this is about the choices we make as we take care decision choices, so that, you know, if there is an alternative to each of these, then why wouldn't we take it if we're hoping that the outcomes from a health perspective would be equivalent? You know, I think there are some really important questions there. And of course, nobody chose to design or use these drugs in the first place knowingly having an environmental impact. You know, we've become more and more aware of that. So I think that we just need to get the balance around it's about having a designed mindset and then thinking about, well, why would you choose these if there are alternatives, which is very similar to the discussion, I guess, that's gone on for anesthetic gases, where the choice was, well, if you've got something that's equivalent, you wouldn't, would you? So anyway, I think we just need to be careful and really clear about what messages we're giving, and also be aware that the media might take one of the messages and take it in a direction that we wouldn't want it necessarily to go, and that will be a choice, but it will certainly get attention.
Yeah, thanks, Fiona. I was talking at a meeting the other day as well, and this whole thing of if you've got two different options, which is is one like the anesthetic or, you know, asthma inhalers, how far does that go? Like, you know, at a prescribing level, that's the choice between two drugs, but it's actually a choice between spending money on prevention versus spending money on treatment. Like, you know, how far do we need that? So yeah, okay, thank you, Fiona. I think, I'm not sure, so there's three more hands, and then I'm going to whiz through the last bit and hopefully come back for the balance thing. I don't know who's next. Was it John or Keith?
John next.
Oh, I don't know who that was. Was that you, Keith?
Yeah, me nominating John.
Oh,
all right.
all right.
Well, thanks very much. Just 2 quick points. You talk about ecotoxicity risk, and yet we've mentioned AMR, haven't we, earlier on in these slides?
Yeah.
And I think we do recognise that the unintended release of these substances into the environment can indeed exacerbate AMR. And given the publication of the new 5-year action plan, might it be timely to include a message like that? In other words, it's more than just the environment here, that people may well be affecting themselves indirectly in terms of compromising their resistance, their ability to react effectively to medication. So I raised that, and I'm happy to go with the flow on that. The other thing, and I think this is a wider chemicals policy issue, so possibly it's a difficult one to bring in here, but we have a mixture of chemicals here, don't we? And we have PNECs and EQSs that have been set to safeguard the environment from exposure to them. And yet we do know, don't we, deep down, that particularly where substances share the same or similar mode of action, that we can, to some degree, assume additivity. So how do we take account of mixtures of chemicals? In other words, the situation may actually be rather worse than we make out. So I put that in there as well. It may be controversial at this point to be raising those sorts of issues, and we may look to those sorts of issues to be addressed elsewhere. But there's certainly 2 points that strike me as being quite important.
Yeah, thanks, John. I mean, actually, the first point, especially because this I've put here, you know, known to pose ecological risk. And you're right, half of these things that are on here are on there because they're a risk to AMR. You know, they're antifungals, some of these things. So yeah, if we did do this, we need to point this out. Yes, and the fact that this is the only you know what we know, and there's an awful things that we don't know, that, you know, it's like likely this is the best case scenario, and it's probably worse. So yeah, I totally agree. Thank you. Keith, and then Sharon.
Yeah, I'll be quick because John's just made at least one of my points, which is about AMR and whether we add that as a defining factor. The other thing is we want to use this as a call to action, and I think we can put a lot of these debate type questions in there as we need more research. Please fund more research in this area. And I absolutely agree that a letter is a good way forward, and I think you can be more provocative in a letter, and I would encourage you to be provocative. I like the NHS drug problem type of approach and the killer fact type approach. So yeah, you've got my backing for that.
Okay,
and I'll shut up. Thank you.
Thanks, Keith. But I do agree with Fiona, having, we don't want the furore to kind of take away from the sense. So yeah, thank you. And Sharon.
Thanks, Kelly. Seems like a really simple paper at first look, but actually it's really complex. With just some of the issues that Fiona has already raised. I don't think a letter is enough to actually do it justice and to bring all the caveats in. Like I said about the MRC work at the MRC Greener NHS event last week, it's not just about one aspect that even out of our MRC research, we're starting to think, okay, if it is drug A versus drug B on an ecotox level, what happens then if the carbon footprint, the microplastics or the AMR driving bit is more or less or whatever? So I think it has to be a balance of all of those. And I think that that's what you would get from industry, because that's what I've got already when I talk. So the advice from one of my daughter's favorite cartoons when she was tiny would be to focus, little princess. The Lancet paper is a big paper. It's a lot of work. Quite agree that the letter could be a good way of getting your message out there. But what do you want to see succeed first? And what will get you the most in the long run?
Yeah, no, great advice, Sharon. And yeah, you're right. I mean, we have got limited resources here, and the priority is definitely getting the roadmap paper out. So I think this accompanying letter, Matt's had a bit of extra, he's had a bit of time to look at this recently. So the idea is if he has extra time, and I'm not saying he's going to, we'll see how we get on. Is this worth pursuing? And because I mean, there's challenges even in this. It sounds very simple, but we can't get hold of secondary care data very easily. I don't know if anybody knows how to get that, but yeah. So anyway, I guess it's even if nothing else, this could be a good, either in a letter, or it's a good way of maybe getting funding to do like a little preliminary amount of facts to apply for more funding to follow on from this. I don't know, but yeah, okay, thank you very much. I'm gonna very quickly whiz through, because I'm looking, it's 10:02 already. I mean really the last couple of things are all very brief. So just to let you know that we have this upcoming panel event, which is on the 30th of May. Sustainable finance initiatives is something that kept coming up when we were looking at our working group reports. It kept coming up in the sort of deep-rooted systems solutions, or leverage points, I should say. And so we started looking into this more, and it's just a whole other can of worms being opened. So we're going to hold an event to start with, which we decided this time, rather than a think tank workshop, we're going to try a public event, like just a 1 hour with a panel. So you've all got this, you should have all got the Zoom diary invites for this, but we're now we've started advertising it externally, so we'll put it on Eventbrite. I don't know how much interest we'll get, we'll see. I will send a link to this in the email that I send out afterwards, so if you can share it, or if you know anybody that would be interested, please do. So it's all going out on social media. And just huge thanks to Courtney, who's in our consortium, Nabucco, who's also in the consortium and here today, I think I just saw. Sam works with Stuart at AstraZeneca, so thanks to them. Rick is friends with Lara and Rosalie at the University of Twente in the Netherlands. He's great character. And Chendi is director of the Sustainable Finance Centre in Exeter. So we've got an absolutely fantastic group of people, and it's just really to open the conversation about this topic. So yeah, thank you to everybody, and yeah, please come along if you can and share, you know, spread the word. And then just really briefly update you. So we're still going ahead with our policy events in London. So we're attending Evidence Week. We have a website now on, you know, MPs and peers can sign up for slots to come and see us. It looks like fresh is fair, so I don't know what this is going to be like, but Charles and I and Matt are going to sort of sell this, and MPs apparently come round and we talk to them about the roadmap and our work. So we're doing that, and we're also going to have a round table event. This is one that Jules organised last year, which was really great. There's a few familiar faces in there from you guys, and the idea is that this is really small, about 20 people. We're going to again ask for roadmap feedback on the roadmap, and we think we're going to try and focus on England policymakers and try and focus on creating a group like the One Health Breakthrough Partnership that looks at pharmaceuticals in the environment, particularly from healthcare maybe, for England. And so that's the plan for that. And thank you again to all these people from the consortium. They're going to sort of form our expert panel and, you know, have just be able to kind of provide feedback and advice to policymakers and set the scene. So yeah, fantastic. And then the plans, I'm not going to go into detail here because I want to hear what Stuart's got to say. But just to let you know, we are still pursuing the charity route. It's going quite slowly. There's various things, but it is in progress, and I'll update you on that next time. So I'm going to stop there. Before we hear from Stuart, does anybody else have any quick questions on those things? Nope. Right, Stuart. Oh, do I need to make you able to share your screen?
Kelly, can you hear me?
Yes.
Yeah, so I think perhaps we should just push that out for when we've got a bit further on with the paper, because these balance pictures are, you know, they're contentious. Who's balance and whose pictures on there. But I did one last week, and I can't see my share screen thing at all. So
you should
it should be there, but I can't see it. So it's fine. But I think it is about the size of those boxes. They're not all the same size.
Yeah.
That and whose hand is on which part and how you balance that. So I think wait till it starts to fit into the paper a little bit better about how you want to actually present that, and maybe it's not as a balance, because that might be the thing that we find hardest as a group by today's conversation to agree.
Yeah.
It might just be here's a list of your favorite things.
Yeah. Okay. Yeah. I mean, that is another option. Either, yeah, it either isn't a figure and it's just all discussed in the text, or we present it in a different way without a balance. Yeah. Okay. So, do you want to? Is it useful for you to send me the pictures, or should we talk about it at the next meeting? Maybe.
Yeah. Let's do that another one.
Okay.
So yeah. There was a presentation I did last week. Hayden's got his hand up now, so I'll shut up.
Thanks, Stuart. Hayden.
Sorry, the last thing I was going to mention as well about the scales thing was some of the benefits also will have risks baked into them as well. So, like if you make people healthier, they'll use more medicines, and that will. So how you factor that into your balancing act, I think, will be interesting as well.
Yeah.
How we factor that into our balancing. Sorry, I don't mean to put
No, that's all right. I mean, I think I'm trying to simplify something that is really, really complicated, and maybe you just can't simplify it. Cool. Does anybody else? We've got a couple of minutes left. Anybody else got any thoughts, particularly on the scales thing, or anything else? Obviously. Yeah. Stuart, then Mike.
I was just going to say I can share my screen whilst Mike's talking.
Go on then.
It's popped up.
Go on then, Mike. Oh, you're on mute, Mike.
If you've got things on a balance, you've got to have you've got to be working with the same metrics on either side, because, you know, without defining your metrics, it really becomes very subjective then as to what what the weightings are for each individual one. So I think as Stuart said, and I think he's possibly saying, and I think as Hayden was saying, it's very difficult to do that objectively without proper metrics and which obviously way beyond the scope of what we can do in this project. And I think you can probably listing the various elements is the easier way, rather than trying to give them individual weightings on a balance chart like that at this stage.
Yeah. Okay. Thanks, Mike. And shall I go to Fiona or Stuart? Do you want to? I mean, it's pretty self-explanatory. Do you want to add anything else to it?
No, I was just going to say I tried to get it was too complicated to do what you've done, so I went for a higher level one and tried to stick with the UN pollution, carbon, biodiversity patches. And I actually think I pointed to the spare rock at the top of the things I don't know about. So
nice, without having to remove it by Photoshop. Yeah. Clever.
Okay.
Yeah, brilliant. It's a nice picture. Thanks, Stuart. Fiona.
I think listing all the things and showing them in some kind of relationship where they appear dynamic and can change over time is also important. And I like the way on a different diagram you'd peeled open the iceberg. I thought that was very effective, and it reminded me of a snowflake, if that's any help in terms of a flower petal, to go back to the iceberg analogy.
Yeah, I had thought about snowflake, and then anyway, I'm not going to go into that now, but yes, across, iceberg, snowflake, you can see it all coming together. But yes, okay. I mean, I quite like the flower thing or snowflake rather than the round circle. It looks a bit more interesting, but yeah. Anyway, it will all be evolving. So brilliant. Thank you so much, everybody. That was really helpful discussion. I hope that this will kind of come together quickly, but we're having really great feedback and buy-in from policymakers. The workshops are proving more complex to get people to come along to, but hopefully we're going to really nail that now. So yes, thank you so much, everybody. All these other people seem really excited about this, so hopefully this will all come to life now in the next couple of months as it comes together. So brilliant, and I will keep you up to date and get in touch with me with any questions. Cool. All right. Thank you.
Thanks.
Bye-bye.
Bye.
Thank you. Bye.
Cheers. Take care.